So today's discussion on fall prevention, thank you for all being flexible, but our objectives for today are identifying fall risk and statistics, defining what it means to fall, discussing what it means to have the fear of falling, identify risk factors for falling, and identify how to reduce your risk from falling. So just to talk about some of the myths with falling. So people often think as we age that falling is a normal part of aging that we have to deal with, and that's not true. Falling is not a normal part of aging, and hopefully this presentation will shed some light onto that. Some people often think, well, if I'm at risk for falling, if I limit my activity or I stay at home, I won't fall. And that's not true either. Staying at home and limiting your activities can lead to social isolation, and it also can increase your risk for falling. I haven't been exercising in a while, so I can't start exercising. I can't gain strength, and that's not true as well. We do lose muscle mass as we age. However, exercise can partially restore our strength and our flexibility, and it's never too late to start exercising. Some people think that using a walker or cane makes them dependent. And walking aids such as walkers and canes, they actually help older adults to maintain and improve their mobility. So if you need these devices to make you safe, it's not a problem. That actually increases your independence. So what does it mean to actually have a fall? So I took this definition from the Merriam-Webster definition. And to fall is to leave an erect position suddenly and involuntarily. This could include slipping or tripping. It does not include those falls that are caused by medical events. So something important for you to remember, a statistic, is that 1 in 4 older adults experience falls. And this can result in hip fractures, broken bones, head injuries, and lead to loss of independence. According to data from the CDC, more than 1 in 4 adults over 65 fall each year. So another thing that I found interesting is that fall death rates in the United States have increased by 30%. So every second of every day, an older adult, 65 or older, falls in the United States. Every 19 minutes, an older adult dies from a fall. So as you can see on this chart, from 2007 to 2016, that rate increased by 30%. So at the rate that we're going now, we could possibly see 7 deaths per hour from falls. Another important thing is once you have had a fall, it doubles your risk for falling again. So once you've had a fall and you experience the fear of falling, I want to talk about how that affects an individual. So if we go kind of from left to right, so how does fear of falling make you at risk? Okay, if you have a fall and you're afraid to fall again, people who fear falling, they may limit their activities. So we have a fear of falling, then we have a reduction in our activities. And then limiting activities in turn can cause someone to become weak or increase their risk for falling. This then can lead to isolation because we don't want to attend social events. We don't get engaged in the community because we have that fear of falling. And then this can sometimes lead to depression. So with that, decreased socialization can lead to depression. So now we'll look at, well, why do falls actually occur? Falls occur because of age-related changes, visual problems, perhaps medications that we're taking, environmental factors lead to falls, underlying health conditions, sometimes progression of chronic illnesses such as Parkinson's disease and multiple sclerosis, and then often accidents can lead to a fall. So when we look at fall risk and we break it down into risk factors that we cannot change and risk factors that we can possibly change. So we can't change our age, we can't change our gender, we can't change the fact that we have certain chronic conditions. But things that we can change, we can change our physical activity levels. We can work on strengthening. So if we're weak, we can work on that. We can change our home environment. If we're improperly using assistive devices, we can change that. Visual impairments, we can change that. And then medication risk. So you see I have a little asterisk there, and it's because some of those modifications require a team approach. So it requires the help of some other individuals to change those risks. So when we look at fall risk factors, I lump them together in physical risk, behavioral risk, and environmental risk. So those physical risk relates to changes in your body that increase your risk for falling. So impaired balance is an example of a physical risk. Behavioral risk are those things that we do or we don't do to increase our risk for falling. An example could be not asking someone for help when we know that we have impaired balance. And environmental risks include, typical hazards in our home or in our community. That could be loose throw rugs or an unclear path, or it could even be pets in our way. And so we're going to take a look at each one. So those physical risk factors. So I want you to think muscle weakness can impact your balance and can impact the way that an individual's walk. So as we age, most of us do lose some strength, coordination, and flexibility. And so primarily inactivity puts us at risk for that, and it makes us much easier risk to fall. So visual changes is another physical risk. So as we age, our vision often changes, and it can make us harder to see contrasting edges when we walk or we go up and down stairs, and put us more at risk for tripping. And then chronic conditions such as diabetes, heart disease, arthritis, these can all increase our risk for falling as well, because we might have decreased sensation, loss of function, inactivity, or pain. Now we move on to those behavioral risks. So behavioral risks include taking unnecessary risk, inattention to task, rushing to perform tasks. So these are all things that we actually can change. We can slow down and we can prevent those behavioral risk factors. And then we move on to environmental risk. So for environmental risk, look at that. Home entry, bathroom, and kitchen. This is where I often see most people fall, okay? So if you take a look at your home entry, for example, handrails. The need to have handrails on both sides going up into steps if you need to. Make sure that those handrails are securely fastened, and hold on to the rails if you need to. Uneven surfaces in the entryway of your house, doormats, those are all environmental risks. In your bathroom at home, some environmental risks include the lighting in the bathroom, slippery tub or showers, the toilet height. Can you get up and down from a lower height? Do you need grab bars around your toilet? And then in the kitchen. The kitchen is one where items are out of our reach. Perhaps you're using a step stool or throw rugs that are in the way. This one is one that I see a lot of falls. In fact, my mother had a fall in the kitchen on a step stool, reaching up to get an item out of the cabinet. So again, that was an unnecessary risk. But those are some of the environmental risks that we see. Additional fall risks we're going to talk about now. And the first one I want to spend a little bit of time on is vision. So more than 12 million Americans that are over 40 experience some type of visual impairment. And it's very important for us as we age to have at least one eye exam every year. If you have vision problems because of diabetes or glaucoma or macular degeneration, it's important that you see your doctor once a year to take care of those problems. And then your fall risk may decrease if you follow up with your eye doctor, and you see what problems you have, and you see maybe if it's cataract. Okay, can you have cataract surgery, and will that improve that risk? So with that, visual function, remember, it deteriorates with age, and it can increase your risk for falling. And then decreased vision, it can also contribute to decreased balance, which puts you more at risk for falling. So then we have chronic conditions and fall risk. So chronic conditions that are listed here can also attribute to your risk of falling. So careful management of these chronic conditions will limit the risk. And so I'm going to just talk about how these chronic conditions can impact your risk. So someone that has diabetes, they may experience decreased sensation in their feet. This decrease in sensation can then cause them to have problems with their balance. Someone that has arthritis, they might experience more pain. Because of the pain, this can affect the way that they're walking, which could also cause problems with their balance. Someone that has had a stroke, it could cause weakness on one side of their body, and it can change their perception to the environment. Someone with a history of some of those neurological disorders like Parkinson's or multiple sclerosis, it may affect their balance and their mobility that increases their fall risk. And then someone that is experiencing chronic pain, they might not be able to stand or stoop, which can weaken their postural muscles and increase their risk for falling. And then someone experiencing depression, the medications that they're on for depression could increase their risk for falling. So we'll talk about medications a little bit later on in the presentation, but it's so important to communicate this with your physician. And then the last one there, or not last one, but chronic obstructive pulmonary disease, also known as COPD, that can cause changes in our lung capacity and how we breathe. And this in turn can cause problems when we change positions and we're going from sitting to standing. And that can also cause us to possibly have decreased physical activity and cause a loss in our balance. Another risk factor is blood pressure and fall risk. So it's important to have your blood pressure checked regularly and speak to your doctor about changes in your blood pressure. If you get dizzy, or if you notice you're getting dizzy when you stand up, when you go from standing to sitting, it's important to let your doctor know that so they can check your blood pressure. There is something that's called postural hypotension, and that is when your blood pressure changes when you change positions. So some blood pressure medicines, they can increase your risk for falling because of the changes in your blood pressure. So again, really important that you communicate this with your physician. So check your blood pressure regularly. When your blood pressure drops, less blood can go to your organs and muscles, and this can make you more likely to fall. So if you notice that you're getting dizzy when you stand up, see your doctor. A doctor can do a series of assessments with you where you sit to stand to see how your blood pressure changes. And be very careful when you start taking new blood pressure medications. Monitor how you feel and let your doctor know how you feel. So now we're going to get more into you determining, are you at risk for falling, and how can you reduce your risk for falling? So the National Council of Aging, they have this great tool. It's called the Falls Free Checkup. It's an online interactive tool that you can go online. I did a screenshot here so you can take a look at, answering some of those questions, and it will guide you through. And then at the end, it will give you an idea of if you are at risk for falling. Something else that you can do is, this is a tool that the CDC has, the Center for Disease Control. And they have a program that's called STEADY, which stands for Stopping Elderly Accidents, Deaths, and Injury. And so this quick assessment will allow you to answer some questions, yes or no. And at the end of that, it lets you know if you scored 4 points or more, then you may be at risk for falling. So this is a great screening tool. It's really quick. And then it's something that you can talk to with your doctor. You know, hey, I did the falls checkup, or I did the fall risk assessment, and it identified that I have some risk for falling. So if you're not worried about you falling, but you're a caregiver, you provide care to someone, there's tools for caregivers as well on the National Council of Agents Falls Prevention Initiative website. And it's conversations and guides for caregivers who are worried about their loved ones who may have experienced a fall or maybe at risk for falling. And you can go through and you can do that falls checkup as well, and you can answer questions catered to those that you care for. Now we're going to talk about taking action. Taking action, what can you do to prevent your risk of falling? So you can exercise to improve your balance and strength. Interesting fact is it takes at least 50 hours every 6 months to improve your balance. Have your doctor or your pharmacist review your medications. That's why, you know, especially the pharmacist, when you get new medications, when you go to fill a prescription or get your refill prescription, have a conversation with them about how your medications interact with each other. Have your vision checked regularly. And then you can make your home safer. And we're going to talk a little bit more about each of those. But these are all things that you can do. And some of those brochures there were taken from the CDC Steady program. And those are all brochures that you have access to that you can go look at and ask yourself some of the questions that are there. So when we talk about exercise and how we can take action, remember that exercise will improve muscles, it will make you stronger, and making you stronger will actually improve your strength, your balance, and your flexibility. So it's important that when you start exercising, especially if you haven't, that you work with professionals that are trained to improve your balance and reduce your risk for falling and increase your reaction time. Trained professionals that I'm speaking of is occupational therapists like myself or physical therapists, because they can work with you and they can address your balance deficits and your fall risk. But also talk to your doctor, okay? Because you may need to get cleared from your doctor before you actually begin a routine exercise program. So other things you can do for exercise is you can look, once cleared by your doctor, let me say that, you can look into participating in community falls prevention program, your local senior centers, local community centers. They have falls programs, falls prevention programs that you can participate in. If your care team, your doctor, maybe your therapist, they think it's safe, then begin a routine exercise program. And maybe you get help from the therapist with establishing that program for safety at home. Have a conversation with your doctor regarding your risk. So if you take that falls checkup assessment, you do some other type of falls assessment, then you can actually see and have a conversation with your doctor and say, hey, I am at risk for falling. This is what this assessment said. And then seek professional assistance from a physical therapist or an occupational therapist. Now, with medications, how you take action is have a conversation with your pharmacist about your medication. Talk about the side effects, especially if you see something on there that a side effect may make you dizzy, because medications can increase your risk for falling. Another important thing with medications and using pharmacists, use one pharmacy. Because that pharmacist will know you, they will know all of your medication. You'll establish a relationship where they can look at all of your medications that you have on file and say, hey, you know, Ms. Lewis, we need to talk about this. And then be sure to read your labels. Read your labels on your medication. One of the things that most pharmacies offer is that once you get a new medication, they have that individual one-on-one time that they actually will consult with you and talk about your medication. So take advantage of that. Then how can you take action with your vision? It's very important to have at least one eye exam a year. And so ask for the annual eye exam after the age of 50. If you have cataracts, remove cataracts. This might reduce your risk for falling. Again, make that yearly appointment for your eye exam and speak to your eye professional regarding visual changes that you have. And then, so how can we make our home safer? So the CDC actually has this safety check or check for safety on their site. So there's a lot of hazards in our home. And this checklist or this guide would be a general guide for you to go throughout your home and check off items that might be at risk. And you can do this room by room. You can also work with an occupational therapist or a physical therapist that has some experience with doing home safety assessments to look at safety and issues in your home. They can provide you some solutions based on your abilities and your individual needs, and that's very important. You also can have a conversation with your doctor. Talk to your doctor about the risk that puts you at risk for falling, so you can get a referral to physical therapy and occupational therapy. Other things you can do is you can seek professional assistance from a certified agent in place specialist. You can have a home safety assessment done to eliminate fall hazards in your home, and talk about how to make your home safer. So now we're going to talk about what happens if you have a fall. What can you do? Having a fall can be very scary. So the first thing you need to do is just take a deep breath and remain still for a few moments just to calm down. While you're down, you need to decide if you feel like you've hurt yourself. If you're not hurt, then you can proceed to slowly move to an upright position. If you are hurt and you can't get up on your own, you need to ask someone to help you or you need to call 911. If you fell and hit your head, you need to seek medical attention because that could cause another problem. Call your doctor when you've had a fall. And then learn how to get up safely, working with your physical therapist or an occupational therapist to help you. When I did this presentation before, I did some techniques on how to get up from the floor. But I would much rather you work with your therapist in learning that, because what I recognize is that everyone moves a little bit different. So what works for one person to help them safely get off the floor may not work for another person. So if you've had a fall, you identify that you're at risk for a fall, go ahead and have that conversation with your doctor to connect you with a therapist so you can practice those techniques of how to get up off of the floor. And so what I want you to remember is that you can take action, and you can take action by doing some of the things that we discussed. You can schedule a routine appointment with your medical provider. You can talk to a physician or the pharmacist about your medications. You can stay active and exercise regularly. You can find alternatives for potentially risky behaviors. You can identify and eliminate fall hazards in your home. Now, for caregivers on the call, you can actually also take action. Have a conversation with your loved ones. Identify the concerns or the fears that they have related to falling. Ask questions about their current health condition. Ask about their last eye exam. Pay attention to their environment and their behaviors. So do they have clutter? When you're around them, are they afraid to fall? Talk about their medications. Talk to their pharmacist, their physician when you accompany them maybe to the doctor's office or to pick up medications. And then recommend additional services. If you see that your loved ones are at risk for fall or have fallen, talk to them about services that they may need. And then I leave you with this, is remember that falls are not a normal part of aging and they can be prevented. So just remember that. So if someone tells you, oh, you're gonna fall because, oh, you're a little bit older now, I want you to remind them, hey, there are things that we can do to prevent our risk from falling. And then these are some of my resources here. And so I am done with my presentation right now. But I see that there's some questions in the chat, and I am going to turn it back over to Miss Tellisford here.
Miss Bodie.
Hi, Keisha. Thank you. This is Angie. Thank you for such a thoughtful presentation. And I'd like to invite our audience now to ask those questions. I think I'm still experiencing some technical difficulties. I don't see any of our audience's questions. So to kick us off, I'm going to again invite our audience to type their questions in the chat again, and hopefully I can see them. But just to kick us off, I have a few questions, Keisha, that I'd like to ask you. How important are the shoes that we wear as we age? I know we're just coming out of summer, we're going into boot season, my favorite season. But how important is it for us to really evaluate our shoe wear to prevent falls?
So you bring up a good point, because we all have nice, cute shoes.
Yes.
That we want to, there, stop sharing my screen. We all have nice, cute shoes that we want to wear. However, the shoes that you wear can impact your fall risk. So I would say, if you're wearing the nice boots with heels and that go across your ankle, but you have problems with your balance, that may not be the best shoe for you. You may need a rubber sole shoe. You might need like a tennis shoe. If you have problems with your ankles, you may need better support. And that little nice, cute boot, it doesn't meet the requirement for a good shoe for walking. And so, yes, I think now there's a lot more shoes that are stylish, that you can use for fashion, that don't have that heel, but you need to make sure that with using those shoes, your balance is good, you're able to walk, you have the right support that you need, especially as the weather changes and it's wet outside or it's slick from ice outside. You need some shoes that will give you some traction to help prevent falling.
Okay. I'd like to build on that, and I'd also like to stop and ask our audience to please ask their questions. I try putting them in the chat again, and let's see if we can see those questions. In the meantime, Keisha, I'd like to build off of my question about shoe wear. I know in the Washington, D.C. area, we have something called the Good Feet store, and I'm always intrigued by that commercial and always threatened to go into that store, but I haven't yet. Is that a good stop for me and others on this call to go into the Good Feet store and have our shoe wear assessed and maybe learn about what brand or type of shoes we should be wearing to prevent falls?
So I guess I'll say two things here. If you have some problems currently with your feet, with the shoes that you're wearing, the first place to start is probably going to be a podiatrist. That's my recommendation. And the reason is, depending on your insurance coverage, especially if you have Medicare, your visit to the podiatrist will be covered by your insurance in most circumstances. Also, depending on types of conditions, if you have certain chronic conditions, certain other medical conditions, there's an opportunity for the podiatrist to prescribe shoes that also can potentially be covered by your insurance. The Good Feet store, I've seen that advertised. I've never been in there. I think they do wonders for some people. I will say that it's not covered by insurance. My father recently went there and got inserts for his shoes, and he likes them, but I know it's a little on the expensive side. But the jury is still out on what he decided for the Good Feet store. But a lot of people do use them. But I would just recommend, if you're having problems with your foot, go to the podiatrist first and start there for your insurance coverage.
Okay, thank you. And I apologize to our audience. If you have asked questions in the chat, I can't see them. So I am experiencing technical difficulties. We will take your questions and we will ask Keisha to respond to them, and in turn, we will respond to you. So again, accept our apologies for any technical difficulties this afternoon. So I'm just going to ask another question or two, if that's okay.
That's fine.
Okay, thank you. Keisha, you mentioned retrofitting our homes. Can you give us a few tips to retrofit our home? Myself, I've had to include night lights. I have questionable vision. Some days it's better and some days it's not so good. But when I have to get up in the evening, I use my night lights to steer me from one room to another. Are there other things that I can do or that we can do in our homes that might not be as costly to help us prevent a fall?
Yes. So what I would say is, good thing you brought that up, Angie, but later in November, I'm actually doing another presentation on aging in place or aging safely in your home. And you bring up a good point. So there are a lot of small solutions that we can use in our home to fall-proof our home. It can start with, just like you said, night lights. Motion sensor lights. If we tend to get up a lot at night to use the bathroom, it lights our path. If we have a problem where we have maybe wooden stairs and the stairs become slippery, we can put things on our stairs in our homes for traction. We can simply, put shoes on to help us walk around our house so we're not at risk for falling. We can do things for grab bars in our bathroom and grab bars or rails or frames around our toilet. We can do things is like simple, remove the throw rugs in our house that might prevent us or might encourage us to trip up. We can put extra backing, non-slip backing on the back of a rug that's in our house if we're more at risk for falling. So those are some of the simple things that we can do. But that's why I said, if you are at risk for falling, you want to look more into how can you make your home safer, working with someone who has the certified agent in place credentials, working with a physical therapist or occupational therapist that has experience with home modifications. Those are all going to be things to help make it a little bit safer. All right, I see questions coming in from the chat now.
They're coming in and I'm going to read them to you.
Okay.
And the first is a take on our conversation. It says, I live in an apartment with wood floors. Is it better to have carpet or rug?
So you know what? That depends. Everyone is a little bit different. So someone that might have some walking or mobility challenges, or maybe using a walker or cane, carpet might be a little bit harder for them to get around. Where someone that doesn't have any of those mobility devices, walking on a hardwood floor may be perfectly fine. The one thing I would just say is about hardwood flooring or laminate flooring or vinyl plank flooring. You just want to make sure that the floor isn't slippery or slick because you don't want to have a fall. But there's nothing wrong with having hardwood floors. Sometimes those can actually be easier to walk on than someone that has a carpeted floor.
Okay, thank you. And I'm going to ask you to build on this a little bit, because the next question reads, what should I do after a fall? And then I'm going to add a part to that. Many of us live alone and we may fall, and we might not have our phones near us or even know our neighbors. And so what if we fall? What do we do if we can't get up of our own accord? What should we do?
So that's always a hard one, because one of the things that I always say is try to keep your cell phone on you when you're walking around at home doing stuff. I have to give a hand clap and kudos to one of my aunts, because she keeps a little crossbody bag with her, and it's very small, but it only fits her cell phone, and she carries that thing all around the house with her because she lives alone. Other things people can do is they get the safety alert systems like Lifeline or Home Secure that they can wear around their neck or on their wrist. If you use Apple products, I know the Apple Watch, it connects to the phone. It has a safety feature on it, so it can recognize that if you have a fall, and it will actually call 911 because it recognizes the force, maybe when you hit a surface. I'm not sure if Samsung has that feature on their phone, but there's a lot of technology out there now that you can use, particularly if you live alone and you're worried about having a fall, so someone else can be alerted.
Okay.
And you can even use the Apple one to call a family member instead of calling 911.
Now, is there do you know if there's an added charge to connecting to Apple or okay?
Nope. So the Apple feature, if you have an Apple Watch, that's one of their safety features that's built into the watch that they have. Again, I'm not sure about the Samsung one. I actually have a Samsung watch, but I've never put on that feature. So
Okay. And this is a great question and near and dear to my heart. Someone says, I notice metro platforms are extremely slippery when we have wet weather. So rubber soled shoes are definitely needed there. And I'm going to just ask a question building on that. If we're prone to falls or we've fallen, and say we fall, God forbid, in the metro, should we carry some type of identification, something in our wallet or in our purse or bag that will alert officials that we are prone to falls and have fallen and we need attention? Is there such an alert?
So there are all sorts of safety alerts in the form of like jewelry. So you can get a medical alert bracelet. You can get a medical alert type necklace that looks like the military dog tags, or just a nice bracelet that will have your medical information, emergency contact information. So if you are at risk for falling, if you are at risk for having other medical emergencies, I definitely would recommend that you get some type of safety or medical alert, jewelry, a bracelet that stands out, or even putting that information inside your purse, maybe identifying it in a brightly colored envelope to just say medical information here. So that's the first thing sometimes that safety paramedics will look for is your identification in your purse. So you could put something in there so they could find that.
Thank you. These are some wonderful questions. Many thanks to our audience. The next question reads, are medical alert devices covered by insurance for falling?
In certain cases, you can get it covered. In certain cases where perhaps you were recently discharged from the hospital, to prevent you from going back in the hospital, some device alert companies will throw in an incentive, maybe for the first 30 days or the first 90 days, you can get the service for free and try it. Also working with your insurance providers to see if some coverage can be obtained there. So I would say it's case by case, and not all the time. But depending on maybe what your coverage is, you can get more assistance for those safety alerts devices.
Thank you, Keisha. Our next question reads, it's asking you if you can please reiterate what medical conditions can increase my risk of falling.
So I think I had a slide that mentioned some chronic conditions put us more at risk for falling. So if someone has diabetes and they have problems with their sensation in their legs or their feet, that could put them more at risk for falling. Others with chronic conditions where they had a history of an old stroke and that stroke has impaired their balance or caused weakness on one side, that could put them more at risk for falling. Individuals with certain neurological conditions like MS, which is multiple sclerosis, or Parkinson's disease. Their muscles change, which can affect their balance, and they get weaker. So those are a few of the medical conditions that can increase the risk of falling.
Thank you. And then I'm just going to add, are men or women more prone to falls?
So women actually are more at risk for falling and more prone to fall. And I would say women, we tend to have more brittle bone structure than men. So if we fall, we're more at risk to have an injury because of that fall. But yes, that's what the studies show us, is that more women tend to have falls.
And it is a misnomer that women of color are prone to falls, correct? All women.
Yes,
All-
women of color are prone to fall. I would say those of us where we find a lower socioeconomic background too are more prone to fall as well. So it's really important to get information out about how we can, falls proof our home and our environment, and do simple things to prevent our risk for falling. Because like I mentioned earlier, when you have a fall, you're more at risk for having another fall, which could lead to a lot of different problems, from physical activity to isolation, to depression. So we want to make sure we can put things in place to keep everyone safe.
Okay. And the next question reads, can you mention some more hazards that would be in my home? For example, is a coffee table a hazard?
A coffee table could be a hazard. Again, everyone's home is a little bit different. We all have a different amount of space in our home. So for someone that may be in a smaller area and they have a coffee table that's really close to a couch, or it limits, they're using some type of walker or cane or wheelchair. The coffee table is in the center of the room and they don't have much space to maneuver. This could be a fall risk. But for someone that has, a lot of room in their living area, they may not be walking with some type of device. That coffee table may not be a fall risk for them. If someone has problems or they have changes in their blood pressure, or they had previous falls and they have that coffee table, it becomes a fall risk, because if you fall and you hit your head on the coffee table, then you could have another problem. So it depends on the home. It depends on the physical mobility of the individual. So it's a lot of factors that go into that. So that's why it's really important, if you're worried or concerned about falling, having a professional come into your home and looking at the environment, and looking at how you move in your environment is really, really important to make those recommendations.
Thank you. And then, perfect question. We have just a few minutes, and so I want to leave you with this question, Keisha. Our question is, when should we take our first bone density test? And then, building on that, part two to that, how do we engage our doctor? Do we walk in and we say, I'd like to have a bone density test? And do we need to give an explanation of why, or can we just simply say, I want to have a bone density test?
You know what, that one, I would say, what I do know is that in our population, Black women, we tend to not get screened, or our physicians tend to not recommend screening for bone density tests. And so what I would say to that is having a conversation with your doctor and asking them, hey, do I need to have a bone density test? Your physician then should look at your risk factors and your age to say, hey, yes, you need this. No, you don't need this. Because I do know that Black women, we are not getting those tests done. We aren't getting those screenings done. But as we age, our bones do become weaker and we become more at risk for having a fall. So I think that's important. Now, the exact age of when you get that bone density test done, I think that could be different for everyone, depending on some of the conditions that you have and depending on your medical history. So it's really important to have that conversation with your physician. Someone that has osteoporosis that has been diagnosed and identified, they may need to have a bone density test and screening much younger, much earlier than someone that doesn't. So again, that's one of those physician-specific questions that you should have that conversation with your physician about when that's needed.
Thank you. Thank you very much. We have a minute, and I'd like to invite our audience to put your questions in the chat. And while we wait for that last question, I'm going to sneak one last question in. Does caffeine have any effect on our bones?
You know, I'm going to say I probably can't answer that one because I haven't read enough about caffeine research on the bone. I will say caffeine does have some disadvantages. It has some advantages, but I don't think I know enough about that one to answer that one to say, does caffeine affect your bone?
Well, thank you. We have 2 questions and we're going to do them real quick. Does vitamin D deficiency contribute to falls?
Vitamin D deficiency can contribute to falls. Vitamin D deficiency contributes to a lot of other things, including having us maybe feel weaker or tired. So if you are low in your vitamin D, speaking to your physician about a supplement to help out with that is really important because vitamin D deficiency can affect your energy levels as well. So again, talking to your physician about that is really helpful.
Okay. Last question and perfect segue. What other minerals do you recommend for good bone health?
I would say calcium, vitamin D, vitamin K, vitamin C. Those are all things that are really helpful in helping out with bone health, and making sure that our bones are good and strong. So those are, again, though, before you start taking a lot of different vitamins and supplements, I would just suggest, you talk to your doctor about those supplements and those particular vitamins that can help you.
Okay. Perfect segue. We are at 2 o'clock. We'd like to be respectful of your time. And so we're going to thank you. Thank you very much, Keisha, for such a thoughtful presentation. Thank you very much to our audience for wonderful questions and for joining us this afternoon. And I'll give you back your afternoon. Thank you.
Thank you so much. Have a great day. And sorry about my little snafu at the beginning.
That's okay. Thank you all. Thank you very much.
Thank you.
Bye-bye.